We are going to try this website. It's called SAMP QS, and it's basically a website that provides questions for people who's sitting for the SAMP exam, part of the CCFP exam. So after you sign up to the website, you have two options: either the instant interactive session or the live practice session. And this traditionally was more of the live practice session. When you click here, obviously I used all my subscription time and it's expired. But let's try to log out and create a new account. So this is how the website looks like, and essentially you can sign in with Apple, with Google, with Facebook. Let me create a new account, and I'm gonna use my email. I'm gonna type in a website password for the website. So sign up. Now after I signed up, it takes me right away to this screen, and let's go start testing and start the live practice. So it gives you 30 minutes. Traditionally it was 4 minutes, but now it's 30 minutes because it's a beta release of the website. And when you click on the start studying, it shows this nice screen here, and since I'm using a computer, it should be fine. This is the timing here. Now let's start studying. So when you start studying, the counter start to show up here, and it asks you, are you ready for high yield SAMP questions? Type your response below. So I have to type our response here, and I will type yes, and then click enter, and then it will ask you for topics. Which topic would you like to study today from the 105 topics? So let's say I want to study a dementia, so I will click number 8 and then enter, and now it's give you a vignette scenario. So it says you are seeing 82 years old woman named Mrs. Thompson in your family practice clinic. She's 82. She's coming to your clinic accompanied by her daughter, who is concerned about her mother increasing forgetfulness over the past year. So Ms. Thompson often forgets recent conversation, misplaces item, and sometimes struggles to find the right words. She has also become more withdrawn and less interested in her usual activities. She has a history of hypertension, osteoarthritis. She lives alone, but her daughter visits regularly. Upon examination, Ms. Thompson is alert but unable to recall 3 objects after short delay. So at this point, I think you are thinking about dementia, and the question is, what would be the next step in assessing Ms. Thompson's cognitive function? Please provide 1 to 2 specific tests or evaluation. So it's asked for dementia. What steps? You need to mention 2 steps. So you can say, I will administer, and this is the biggest part of this exam, that you practice the typing ability, MOCA or Montreal Cognitive Testing. And because in the exam you have to be fast typer, okay? This is the number 1, and then number 2, you when you click shift enter, you go to the second line, and then you can say order serum thyroid, let's say thyroid stimulating hormone test. Okay, this is a complete answer. Now you click enter. Your answer includes administering MOCA, which is a correct choice. It's widely used for screening for mild cognitive impairment. However, ordering a serum TSH is not specific enough regarding assessment of cognitive function directly. So this answer was not right. While TSH can be part of the investigations to rule out reversible causes like hypothyroidism, but the question asks, what are the steps to assess directly? So MOCA or MMSE in 1 line, and a complete history and physical examination focusing on neurological and psychiatric aspect. And that's a complete line here, and it gives you 50% of the questions is right, and it gives you where are you at. Would you like to continue? So you can ask for more difficult question. If you click here, need more difficult questions, it gives you a harder question. Giving Thompson presentation and history apart from cognitive assessment, what are 2 additional investigations would you consider to further evaluate causes or contributing to cognitive function? Please specify these investigations and explain why they might not be relevant. So in case you don't know, you click no idea and it tells you the answer right away. Serum B12, brain imaging and MRI or CT. So this all done in you have remaining 25 minutes. I want to pause here, and you can use this in your mobile on the go, so you don't need to actually use it on the computer, but the computer will give you the best experience. Let's go back there, and let's say I want to try the other product. So we tried this one. I want to try the instant interactive session. So this gives you a variety of options to select. If you want to study social and ethics, emergency conditions, I really highly advise you to study it from here. Let's say I want to do ACLS, atrial fibrillation, chest pain today, and I want to also try neck pain, and I want to study some children pediatric ethical issues. Now when you click start, it will generate 10 questions. So when you click start, the model depending on your performance will start to generate questions for you, and this may take some time, but once it's generated it will show the questions right away, and it's a very similar layout on what you're gonna see on the similar exam in the exam. So this may take some time, and it involves deep analysis of the current trend answer pattern from the user. So it will take some time to generate the questions, but it will eventually show the answers, show the questions. Okay, so now it generated 10 cases, and there is a timer here, and this is a question, and these are the cases. So let's study this. Case number 1, 55 years old male collapsed while exercising at the local gym. He has history of hypertension, smoking. Bystanders called emergency services and initiated CPR. Upon arrival, EMT found the patient pulseless and initiated ACLS protocols including defibrillation and epinephrine administration. Return of circulation was achieved after 10 minutes. Question: mention one important treatment step to be taken after achieving ROSC in this scenario. So this is a very typical question from the exam. This is how it's usually asked. So you need to read the stem, and then you need to decide one important treatment. What important treatment after return of circulation you should do? So there is an important step. I remember it was targeted body temperature. I think I wrote it spelled wrong here. Target body temperature treatment, I think, to preserve the brain function. Let's see. So you will submit the answer, and the answer will be examined and results will be generated. Very typical. So this is an active live model. You are dealing with the material right away. So it says the answer is correct. Targeted temperature management, also formerly known as therapeutic hypothermia, is an important step after achieving return of spontaneous circulation in a patient who has suffered cardiac arrest. The targeted temperature management has been shown to improve neurological outcomes in comatose patients post-cardiac arrest. This involves maintaining a stable, reduced body temperature for a specific period. Patients should be cooled to temperature of 32 to 36 for at least 24 hours following RUSC. So you're gonna go to the next question. Next question, same scenario, same case. Mention 2 lifestyle changes this patient should consider to prevent further cardiac events. Very typical for this exam with 2 lifestyle. Someone will say regular, and this has to be specific, very specific. Regular exercise at least 150 minutes per week. Now in the exam you will not have this auto completion feature, and you don't forget there are 2 things. So first one is this, the second one is stop smoking cessation, because it's written here, so you need to answer it straight to that. So smoking cessation is the second answer. Let's submit the answer. So as you can see, it's fairly straightforward. You just need to wait a little bit for the questions to be generated, but once it's generated, the answer, the questions will show and you can type in the answer right away. The provided answer is correct and addresses 2 important lifestyle changes to prevent further cardiac events. Regular exercise helps improve cardiovascular fitness, control weight, and lower overall risk for heart disease. Smoking cessation is crucial as smoking is a major risk factor for cardiovascular, and quitting smoking will reduce this risk. To further enhance the answer 1 could include what? Maintaining a healthy diet, and you have to be specific. I think you should say something around DASH diet, especially with hypertension, and managing stress. You need to talk a little bit about that in a very specific way as important lifestyle. So these are the 2 questions in this case. Let's go to the next case. Next case, 32 years old female present to emergency department with palpitations and dizziness. With history, her history reveals occasional episodes of atrial fibrillation. Physical examination shows an irregular pulse. ECG should confirm atrial fibrillation. Initial management done with rate control. Anticoagulation is considered due to moderate. Mention 1 medication class used for rate control in atrial fibrillation. Okay, so you need to think about this, and what the class, there are 2 classes here you can use. For rate control you can say beta adrenergic blockers, beta adrenergic blockers. Let's see. Oh, I forgot to add the L here, so blockers, not blockers. So this is the importance of why you should practice this. Okay, this is very minor mistake, but it changes the total understanding. So that's why I really advise you to practice this daily. Beta adrenergic blockers are a class of medication commonly used for rate control. They work by blocking the effect of adrenaline on the heart and reducing heart rate and improving rhythm stability. So one of them, metoprolol, atenolol, carvedilol, they are effective in managing symptoms and preventing complications. Next question, same case, 32, presents with palpitations and dizziness. Mention 2 lifestyle modification to reduce frequency of atrial fibrillation. So you need to think about the case in front of you. If there is any risk factor, you can mention it. And so you can say limit alcohol consumption, and you can also say regular exercise for what it's worth. You have to be specific again and typing this, and it takes time. You can see that I ran out of time here because I have to be quick. The provided answer is correct and succinct. Limiting alcohol consumption, engaging in regular exercise help reduce the frequency. Alcohol can significantly affect the rhythm, so reducing intake may minimize the episodes. And I really advise you to go and read about the CFP journal regarding this. Additional lifestyle modification, weight loss, avoiding excessive caffeine, and managing stress. So let's go to the next case here, and I will finish with this case. If you like the website, it's SAMP QS. I really advise you to sign up there right away and go and try the question bank, and see if that works for you in your preparation. So case number 3, 45 years old male with a history of hyperlipidemia experiences sudden chest pain while at work. He is sedentary office worker with a stressful job. Physical exam shows diaphoresis and elevated blood pressure, and ECG indicates ST elevation in leads 2, 3 and AVF. Immediate administration of aspirin and PCI is performed. Mention 1 other immediate medication required following aspirin administration in this scenario. Okay, so you have to think about it very carefully. What medication would you give following aspirin in this scenario? So I would say low molecular weight heparin. Okay, and I will let you go and read about why we give that, why we give heparin in this patient specifically. And the answer is correct. After administrating in patient with suspected acute coronary syndrome, is immediate medication is anticoagulation, okay, to help prevent further formation of the clot. This is part of standard protocol alongside intervention needed. And I guess I will conclude with this case here. This is case number 3, so there are 10 cases here, and you can always in the session it will give you the time efficiency here, 5 minutes and 28 seconds, and the overall scores need to do 20 questions in order for you to see your ranking. And you can always go back and change from emergency if you want to try immigrant self, reproductive gender specific issues, bad news, domestic violence. There are many cases, and you can increase the number of cases up to 40, but at this stage I advise you just to try 10 cases at a time. And you can start right away. This feature is now on beta, so it's free. You don't need to subscribe for it for now. This one will offer 30 minutes and you can use it on the phone, and after that it will be fairly reasonable, $8.99 and $17.99 and $36 for the number of hours given. So 2 hours, 4 hours of practice and 8 hours. And it doesn't need any more information from you. You can go to the website and sign in right away and start using the product. Thank you so much for listening to this presentation, and if you like it, you can subscribe to the channel. I thought it may be useful to share this, and we'll upload more videos similar to this product. Thank you.